Hi everyone, my name is Dr. Jessica Hoops, and I'm the One Health Research Coordinator for Animal Management in Rural and Remote Indigenous Communities, also known as AMRIC. We're an Australian not-for-profit that works with rural and remote Aboriginal and Torres Strait Islander communities across all areas of animal management. I'd like to start off the presentation by acknowledging the Yirrkala, the traditional custodians of the lands that I'm presenting to you from today. I offer my deep respect and gratitude to all Aboriginal and Torres Strait Islander elders, past, present, and emerging. I also extend that respect to all Aboriginal and Torres Strait Islander peoples tuning in today. Dogs play an important and versatile role in Australian Aboriginal and Torres Strait Islander communities, serving as loyal companions, physical and spiritual protectors, hunting aids, a source of warmth on cold nights, and helping to ward off pests and invaders. For some, dogs are woven into the fabric of community and culture, their language centers, kinship systems, and totems. Most dogs roam freely out of choice, but there's always someone looking after them, be it an individual, a family, or sometimes even the entire community. Despite the value of dogs, for many remote communities, there are barriers to accessing animal health and veterinary services, making preventative care very challenging. These barriers, coupled with variable knowledge about dog health, has led to overpopulation and poor dog health status in many remote communities, with higher rates of infectious disease relative to owned dogs in urban locations. Because dogs live closely with people and share the same environment, the health and welfare of dogs in communities is intrinsically linked to the health and well-being of people, both through the transmission of zoonotic diseases, as well as the negative impacts of poor dog health status on mental health and social well-being of community members. The free-roaming lifestyle of these dogs increases the likelihood of interactions with other dogs, domestic animals, and wildlife, which in turn can increase the risk of disease exposure. Cohabitation with people, which is common in communities, has also been shown to increase the risk of zoonotic disease transmission. In many communities, public health risks associated with the dog population are amplified by disparities in social determinants of health, such as hygiene and sanitation, which can predispose to infections. These public health concerns have prompted funding and the implementation of dog health programs in many communities, with the goal of improving community health. Typically, these programs include visiting vet services for 2 to 3 weeks per year, where they deliver surgical desexing for population control, as well as preventative treatments including antiparasitics to help improve the health and welfare of animals, but also reduce the risk of zoonotic disease transmission. To give you some perspective on some of the challenges faced by dog owners in these communities, take a look at this map. Many Australian Indigenous communities, which are shown as the grey dots on the map, are found in remote and very remote parts of Australia, which are shown in the pale and darker yellow colors on this map. In these areas, vet services and animal health products are hard to come by. For many communities, the nearest vet clinic is hundreds, if not thousands, of kilometers away. If we take the Northern Territory, for example, which is an area of almost 1.5 million square kilometers, there are only 5 regions that have permanent vet clinics, which is indicated by the red dots. That's a whole lot of country surrounding these regions where vets aren't permanently available. What's more is that in many communities, preventative treatments and animal health products aren't available locally, so pet owners are unable to gain access to these medicines, like antiparasitic treatments, unless they're available as part of an animal census or vet program in the area. There are very few studies that have looked at the prevalence and diversity of parasites in dogs in Australian Indigenous communities. But based on experience and anecdotal reports from those working in the field, parasitism is widely acknowledged as a primary dog health problem in many communities. While parasites can have major impacts on the health of dogs in communities, especially for puppies, zoonotic parasites have also been reported, such as scabies, roundworms like Toxocara and Strongyloides, and hookworms, supporting the concern that these dogs may serve as a source of infection for people. As a result, parasite prevention and treatment has become a fundamental part of community dog health and management programs. For most programs, parasite treatments are mass administered to all accessible animals over a short period of time, a few times a year. This often occurs in conjunction with a census or veterinary program in the area. Unfortunately, this context is not well reflected in existing guidelines for companion animal parasite treatment and prevention, which largely focus on individual animals with consistent access to vet services. To help review the use of antiparasitic treatments in dog health and management programs and to inform the development of effective and judicious control programs, we looked at patterns of parasite treatment and prevention used by AMRIC and its vet partners as part of its companion animal health programs. To do this, we reviewed data captured using AMRIC's custom-developed applications designed for record keeping in this specific context. The initial database contained over 60,000 treatment records created between October 2013 and June 2022. Data cleaning was used to remove any record containing cats, data from non-participating communities where consent from the veterinary partner wasn't possible, treatment records that didn't contain parasite treatment, so desexing, antibiotics, or pain control, and deduplication of records where the same treatment was given to the same animal on the same day, which are likely due to an application or data extraction error, but could reflect repeated dosing to the same animal. The final dataset consisted of 36,297 treatments administered to nearly 17,000 dogs in 123 different communities across 26 local government areas. 1,791 of these records basically just included the term parasite treatment or other under parasite treatment without further elaboration as to what was given and were excluded from further consideration. Across the period of study, we saw an increase in both the number of animals treated per year and the total number of recorded treatments administered. However, this trend is likely due to increased use of AMRIC's applications, which were first released in 2013 as a data capture tool, as well as expanding activities of AMRIC and its partners. Given the constraints imposed by working in remote environments, many of these programs have involved administration of parasite treatments to large populations of dogs in a short period of time, with the periods between programs extending beyond the recommended dosing intervals for most of the preventatives. In between programs in many communities, there are minimal options for owners to purchase these drugs locally, so many animals don't get any parasite treatments unless a census or veterinary program is underway. If we look at the frequency of parasite treatment use across all years, we see that ivermectin accounts for over 55% of all parasite treatments, followed by the azoxazolines Florilanar, which is Brevecto, and Afoxolanar, which is NexGard. With limited parasite treatment options available before the izoxazoline class of medications was released onto the market in 2014, many parasite control programs have historically relied heavily on off-label use of high doses of injectable ivermectin formulated for livestock. This medication is often mixed with butter and administered orally as a sandwich. Historically, ivermectin has been favored due to its broad-spectrum activity as well as its affordability. In particular, ivermectin has been found to be effective against a number of intestinal worms and scabies, which are not only common in dogs in these communities, but also pose a threat to the health of people. Although ivermectin has been the most frequently administered antiparasitic treatment across all years, there's a decreasing trend towards the use of ivermectin, offset by the increased use of izoxazolines as well as broad-spectrum dewormers. From the available data, it's not possible to tell how or understand the motivations behind these trends. However, there's some significant events that may have influenced the transition away from ivermectin towards the use of izoxazolines and dewormers. The first is simply the introduction of the izoxazoline class of antiparasitic agents to the vet market, which occurred in Australia between 2014 and 2018. The second is the incursion of Ehrlichia canis, a bloodborne bacteria that can cause life-threatening disease in dogs. The disease was first detected in Australia in May 2020 and has spread rapidly across the country. It has had a devastating impact on the dog populations in Indigenous communities. Although it's speculative, the fact that this bacteria is transmitted by ticks has likely played a major role in the decline in the use of ivermectin in community dog health programs, given that ivermectin is not very effective against ticks. In addition, the profound impact of E. canis on the welfare and health of dogs and communities has influenced sponsorship of parasite control and prevention programs by pharmaceutical companies, including those supplying some of the newer antiparasitics, which has had a major impact on the accessibility and affordability of these medications in community animal health and management programs. If you'd like to learn more about the impacts of Ehrlichia canis on dog populations in Australia, be sure to check out the talk by my colleague, Dr. Bonnie Cumming. So what do these trends mean? The fact is that preventative treatments such as antiparasitics are a regular part of many dog health and management programs around the world, often with the motivation to both improve the health and welfare of dogs, but also reduce the risk of disease spread to people. In resource-limited environments, when we think about parasite treatment and control programs and incorporating these into our management activities, some of the things we think about include what treatments are available and how much does the medication cost. It's important to note that program sponsorship, donations, and subsidized pricing can have a tremendous influence on the treatment selection in many of these cases. We might also think about the type of parasite we want to treat, although this is often limited to visual observations of parasites in dogs. Can the medication prevent against other parasites? How long does it last? Is it easy to give? And is it safe? With increasing recognition of the interconnectedness between the health of humans and animals, it supports the continued delivery of these programs as part of dog health and management efforts. This means that having safe, effective, and sustainable parasite control programs is of the utmost importance. It also includes thinking about potential impacts of these programs on people, other animals, and their shared environment. The two main questions we really need to ask ourselves is, are these programs effective and are they safe? From a One Health perspective, some considerations for public, environmental, and ecosystem health along these lines include the spectrum of parasite coverage and how that affects zoonotic disease prevention, the potential for development of antiparasitic resistance, the risks of human exposure and toxicity, and the potential for negative impacts on non-target species. In Australian Indigenous communities, parasite control programs are motivated by improving the health and well-being of dogs, but also by reducing the risk of parasitic zoonoses. In order to do this effectively, treatment decisions need to be based on an understanding of what parasites are present in the dogs in a given community and their prevalence, focusing on the parasites that have the greatest potential impacts on human and animal health. At present, there's limited research on the prevalence of parasites and parasitic zoonoses in these communities. When you're on field programs, there's often a limited diagnostic capacity to determine parasite prevalence, but also to monitor for changes in parasite ecology and abundance as a result of these parasite treatment and control programs. Many dog health and management programs rely on visual observation of parasites on dogs and other health indicators such as body condition and skin condition to gauge parasite burdens and to monitor the success of these programs, which really makes it difficult to determine the true impact on dog health and well-being. There is even less research looking at the effects of these programs on the incidence of parasitic zoonoses in the human population, meaning that the public health impacts are poorly understood. Practical strategies for evaluating the prevalence of parasites in dogs, as well as the incidence of parasitic zoonoses in people, are necessary in order to inform the selection of antiparasitic agents, to allow for objective impact assessment of parasite control programs, and to allow for improved surveillance for the potential development of antiparasitic resistance. Compared to the development of antibiotic resistance in bacteria, resistance to antiparasitic treatments has been slowed to develop under field conditions, particularly in companion animals, and has therefore received little attention. However, many antiparasitic agents have features that favor the development of resistance, and with a limited number of treatments available, resistance in companion animals is becoming increasingly recognized. For example, multi-drug resistance has already been reported for both canine hookworms and heartworms in dogs, mostly in the United States. The potential for resistance is particularly concerning for medications that have a crossover for use in human health. For example, ivermectin is effective against many common parasites in dogs, but it is also one of the only drugs available for the treatment of scabies, onchocerciasis, and strongyloidiasis in people. Dog health and management programs in Australian communities occur sporadically and take place in open systems, with a high potential for refugia, or parasites that don't get treated, living in local wildlife populations, which may limit the potential for resistance development. However, constraints imposed by working in rural and remote environments may favor the development of resistance to antiparasitic drugs as a result of the administration of antiparasitic treatments to a large proportion of the population at the same time, repeated dosing with the same drug over time, the use of weight estimation to determine dosage, which can result in over or underdosing, and the inability to monitor response to treatment, like with using fecal flotation or skin scrapings. The use of integrated approaches to reduce environmental parasite contamination, combination therapy, or administration of different products over time, and targeted treatment of animals with evidence of infection may help to reduce pressures that favor resistance. Another factor we don't often think about is human exposure. While the risk of human toxicity with correct use of these medications is believed to be low, it is important to recognize that these medications do not undergo human toxicology studies before being introduced to the market. Especially for the newer agents, the effects of short and long-term exposure have not been investigated. Antiparasitic treatments that are administered orally, like the macrosidic lactones and isoxazolines, are excreted in the feces, so the potential for human exposure is low unless there are concerns for sanitation and improper handling of dog waste. However, topical medications, including spot-ons, tick and flea collars, etc., which are becoming increasingly common in dog health and management programs in Australia, carry a greater risk of inadvertent human exposure and thus a greater potential for long-term human exposure with regular use. Regardless of the way the treatment is administered, it appears that the use of flea and tick treatments in dogs, regardless of their mode of administration, serve as a potential source of exposure to people. For example, a recent study by Dipens et al. Found that evidence of both dog-to-dog transfer of antiparasitic medicines, as well as the potential for dogs to transfer certain medications to the aquatic environment after swimming in a pool for a period of less than 6 minutes. It's really important to acknowledge these risks of human exposure and ensure proper communication on safe handling of medications with community dog owners, especially for those topical medications. There is also increasing concern for the potential environmental consequences of widespread use of these drugs in veterinary patients, given their broad spectrum activity and potential impacts on non-target species. Australian Indigenous cultures share a strong connection to country, the lands, the waterways, and seas to which they are connected, which also makes understanding the risk of ecotoxicity associated with these programs important. While research on the ecotoxic effects of antiparasitic agents is limited, especially for the newer medications, available studies from drugs that have been on the market for a long time, like ivermectin, fipronil, and imidacloprid, show that both the potential for environmental contamination as well as the potential for toxic effects in non-target species, with the main concern being aquatic invertebrates. For example, recent studies show widespread contamination of English rivers with fipronil and imidacloprid, both of which are used in flea treatments in cats and dogs. For topical medications given to dogs with little restriction of animal movement, there's a greater risk of environmental contamination as a result of swimming or rainfall wash-off before the medication has been absorbed. Increasing trends toward expanded use of antiparasitic treatments in dogs in these communities warrants further consideration in order to mitigate the risk of environmental contamination. Given the trends in parasite prophylaxis and treatment in community dog health and management programs, there's a need to critically evaluate options for the implementation of effective and judicious parasite control strategies for use in population-level parasite treatment. Further research is required to address existing knowledge gaps in this space, with a specific focus on the culture and context of companion animal health programs in rural and remote Aboriginal and Torres Strait Islander communities. To do this effectively will require close collaboration between professionals across different health disciplines, which is the basis of the One Health approach. I will now open up the floor for questions.